So, good morning, everybody. And again, thank you for doing the right stuff out there and getting us through this because we'll get through this working together. So, as of today, we have 2,339 positive cases of the coronavirus, and then we have 559 people under mandatory quarantine. As of today, we have 11 new positive cases. And among the new 11 positive cases, one is a healthcare worker. 5 have had close contact to positive cases. 1 had reported traveling, and 4 we're still working on the source to identify how they got it. So as of today, also we have 7,797 people who have completed quarantine. 2,295 tested positive for the virus, have recovered, and that's an increase of 9 today, so which is good. We still have the same hospitalization rate and the same amount of people in the hospital, 3 people in the hospital, and the hospitalization rate at 0.12%, same as yesterday, and 1 still in the ICU. Some of the things we've been looking at the trend the last 2 weeks, and if we go backwards, yesterday was 6, the day before that was 12, Tuesday was 6, Monday was 9, and then we had a couple over the weekend. I think it was like 9 and 6, and then that one day we had 20, 12, 7, and 20 that one week, which we have traced it to the Hudson Avenue party. So as we continue to do the right thing and moving forward, the 5-day average positive case is 8.8, a little bit up from yesterday. Yesterday it was 7.8, so we kind of did a little bit of an uptick there. But again, as the governor continues to tell people to get tested, whether you have signs or symptoms, please do that. It's important, because again, the more we know who's had it or who's infected, it helps us going forward in decisions being made like opening up more stuff, getting back to a semi-normal life, what we're used to. It means that people can hopefully start going to the movie theaters and gyms and stuff like that. So in order to get there, we need to know where we stand. So as of today, I'm encouraging everyone, please continue to get testing. And our testing is not as high as it was a couple of months ago. So I know I get them comments on Facebook saying that, we're testing more, that's why you get more positive cases. We're actually not. It's like a little bit lower than a couple months ago. So I would like to get the testing back up there that high to get it done. But as always, you can go to the University of Albany, and the number is 1-888-364-3065. And then our mobile testing sites run through Whitney Young, area code 518-465-4771. And again, if you don't have insurance, it's free. UAlbany is free. So there's no excuse. We can get you there. And if you don't have transportation, we have the mobile walk-up site. So again, to get it done, Priority 1 in Gilliland, where you can get your antibody testing done, 518-867-8040. Just want to remind people I'm getting a lot of complaints, or I shouldn't say complaints, questions on why it's taken so long. It seems to be taking longer than it was a month or 2 ago. I don't know why. I don't know if it's the laboratories. We've looked into it. We didn't have a control room meeting yesterday. We do today at 2 o'clock. Hopefully we get the guidance on schools today, what that's going to look like as they try to reopen up in the fall, whether or not it's going to be limited or if it's going to be delayed. So hopefully we'll know that today from the governor's office. But for the people that keep inquiring, I don't control laboratories. I don't know where they send them. And, the reason why it's taking so long, I don't know. But in certain cases, it is taking 5 to 7 days to get back. And yes, you should stay in there until you get there. So again, please continue to do the right thing. Do the 4 things. Clean your hands. Wear your mask right. Cough into your arm. And stay 6 feet apart. And we'll get through this as we continue to get through it. Wearing your mask the right way is so important. I know Dr. Whalen always gives that a little bit of a class, and how to keep it over your nose. If it's not on your nose, it's not going to help you. If it's under your chin, you put it back, it's going to be contaminated. I know it's hard, and there's people making comments about touching your face. Make sure you clean your hands. I will assure you, doing this for 6 months, I don't know what it is, but my face starts itching automatically every time I'm up here. Whether it's itching or not, it's so it's kind of hard not even to itch your nose or scratch your eyebrow, but it's just, I don't know if it happens. We always joke around. Automatically, you sit here and you feel like your face is itching, But so I try not to either, and constantly clean my hands. And please, everyone needs to do the right thing to get out of this. So some of the other things, kind of switching gears. A lot of questions we got on from the beginning, 6 months ago, through this whole thing. A lot of logistics go on that people don't see, but one of the biggest issues we had to tackle was the homeless population. We had homeless shelters, we had homeless people in the streets. How do you address that issue going forward? And again, trying to keep social distancing, wearing your mask, and doing the right thing. So these are things that we had to address as we've gone forward, and I couldn't have asked for any better partners than we have as our Michelle McClain, our Commissioner of Social Services, and Liz Hitt from Hattis, who we've been in partnerships probably my last 8.5 years since I've been in office, doing great jobs. And, so one of the things we want to talk about, these shelters, Cold Blue shelters, been around the clock. They go 24/7. So these are things that haven't stopped. But the unique thing this time was the 2 Cold Blue homeless shelters for individuals and families stayed open even after we got out of the season. Stayed open, obviously, because we saw the need for that. We saw the need for shelter and looking at things differently. Our shelters operate over 400 beds here in Albany County. There are also several private operating shelters in the county which provide shelter. So we had to coordinate with all the different private shelters because, again, of the social distancing and making sure they do the right thing. Reverend Perry does a great thing down at the homeless shelter in downtown Albany, but the problem is, at 7 o'clock they have to go out on the street. And then obviously that turns into other problems. The shelters also had to follow the CDC homeless guidelines for shelters. And, again, we had to educate a lot of people on how to do this going forward. Was there hiccups? Yes. Was there stumbling? Yes. Were there mistakes made? Yeah, obviously, because it's all new to everyone. And then, again, trying to educate and have a homeless person wear a mask, it's tough, and even when you see people out panhandling, one of the things I always say to them is, please, here, I hand a mask to them, wear a mask, not just, again, for your own safety, but if, God forbid, you're positive and someone wants to try to help you and give you money, then it's going to have the reverse effect. So that good deed's going to go not unpunished, meaning that you could get infected by handing out money to somebody that's standing on the street corner without wearing a mask, and so you got to be careful. So it works both ways, but again, we've been getting through all this, working together for the homeless and making sure that we go forward. Some of the other stuff that we did early on, we had to set up porta-johns downtown through the city of Albany, which we ran. I know Liz will talk about. Ashley House was nice enough to take that over at the end of July. Somewhere, all right. So and you can talk. It's all right. Oh. Okay. Yeah, you can say something. So it was at the end of July they took it over, and but we did see a need. There's a safety and health standpoint, not just for the homeless people, but for the people in downtown Albany walking around. There's issues that we constantly have to address, and we are in a partnership trying to always constantly get this done. DSS has housed 64 homeless individuals in motels that were homeless that we had to get off the street, or either positive or were in contact with someone who was positive. So we put them in hotel rooms to try to isolate them from everyone to stop the spread, because you can imagine it's like a ripple effect in the homeless community when people aren't socially distancing and wearing masks, and they're sharing alcohol together and drinking out of the same bottle, or sharing drugs. It was something we really had to address and get really deep into to make sure that we stop the spread in to the best of our ability. But again, it couldn't have happened without the partnership. So I can't thank Liz Hitt and Hattis and DSS for making this happen. But Michelle, would you like to jump in and talk about what your department was doing and helping with everything going forward?
Yep, thank you very much. The county executive has pretty much outlined a lot of what we've done since March with the homeless shelters and our contracted shelters that we work with. As the county executive said, we have 7 contracted year-round shelters and 2 code blue shelters. So one thing to note is that the homeless tend to be very vulnerable to COVID, and that's because there's a good percentage of them that are older and also have pre-existing conditions, diabetes, heart problems, as well as issues with substance abuse and mental health and behavioral health issues. So they are particularly vulnerable. And we have worked with our shelters to provide them with support, information. We learned together with the shelters as this all started. We were in contact with them on an almost daily basis, particularly in the beginning, to provide them with the information and support they needed. They've worked really hard to implement a lot of the CDC guidelines designated for homeless shelters, and that includes having clients and staff wear masks, socially distancing amongst the clients and staff, doing food service a little differently, not congregating in groups for meals, having box lunches and that kind of thing. Sleeping head to toe as opposed to head to head, having beds 6 feet apart. The county provided masks for staff and clients, gloves, sanitizer. And they work really hard to do cleaning in between every day, in between when the clients leave for the day and come back. So pretty confident in what our contracted shelters have been doing to manage COVID amongst the clients, and they're taking temperatures and just really watching the people that are walking through the door to identify any symptoms or anything like that. We've had a good partnership with the County Department of Health. If we suspect that someone or if they suspect that someone may have symptoms, we make sure we get them into testing. And as the county executive said, we've quarantined a number of people who have symptoms or were positive in motels, and so they can stay there for the 2 weeks away from the rest of the population. We have also worked with HADIS after hours. When calls come in from emergency departments where they potentially have someone who has COVID, who is homeless, and make sure that those people don't go back into shelters or back into the street, that they get into private locations. We've also worked with the New York State Department of Correction Services, where you may have heard of the inmates have been early released from correctional facilities to help prevent COVID. So some of those folks were homeless, and we worked with them to provide shelter. And one of our goals primarily is to prevent homelessness. So we prefer people not become homeless. So DSS provides benefits that pay for potentially rent arrears, for security deposits, for moving expenses, and to negotiate with landlords to help keep people in the homes they're already in. That's what we really want to do. But when that's not possible, we work with folks to help them either move to a new place or pay their back rent so they can stay. Now, we're very concerned, of course, when the moratorium on evictions is lifted on August 20th, what will happen. There's a lot of people I know in the queue for evictions, and it's very concerning to the community about the number of people who are going to need assistance when that happens. So there has been people can come to DSS, and they can also come to other community partners, because funds have been allocated from HUD through New York State down to the city and county to pay for eligible people for rent arrears and potentially rent going forward, in order so that people can stay in their homes as opposed to becoming homeless. This is a particular concern for families. We have seen actually the eviction moratorium, we've seen a reduction in the number of homeless families. So that's been a really great thing. So we want to keep it that way so that our families do not become homeless. So I'll pass it back on.
I think the governor signed yesterday the extension for evictions under the COVID, that they can't be.
Oh, fabulous.
If it's COVID related, COVID-19 related, that they cannot be evicted if it's a hardship from that. So you have to define that. So that will help us going forward, because it is going to be a big issue. Again, not trying to scare people. Besides this health crisis, we have financial crisis going forward, and you're going to see, unfortunately, a lot of people lose their homes or get evicted or need assistance that they never had to use before, unfortunately. And especially, I know some of the the Bureau Labor Statistics was released and updated for unemployment numbers today, but it was on a national level. We didn't get ours, but on a national level, it said it went from 11.1 to 10.2% across the country. We're waiting to see what it's in the county, and it's going to be tough. It's going to be tough, and I do want to say to you and your department, thank you for everything that you did, because when everyone else got to stay home and do the right thing, your department didn't shut down, and that's what I like to explain to a lot of people. We are obligated by the feds and the state that there's certain programs that we can't just shut down, and regardless of what's going on out in the world, and you have the coronavirus, or it's a snowstorm, or it could be a hurricane, we still have to show up every day and do our job, because families depend on it, and that's how we're going to get through this, doing this together and working together in a partnership. And I know someone was busting my chops counting how many times I said partnership. I say it a lot because we're in this together, and we can't get through this without being in a partnership and leaving the egos at the door. I say that all the time because that happens in politics. Our egos get in the way of doing good things because someone doesn't like somebody or someone wants to be the bigger person in the room. I can assure you that has to stay outside the room, and we now more than ever need to represent the people and continue to do services. And we can only do that not just working within government agencies or cities and towns and villages or with the state or the feds. It's partnerships like Hattis and the good stuff that you've done over the years, from our coat drive, helping us with that, helping homeless veterans, and doing everything. We're both Army veterans, so it's again, thank you always for your service, but the story, and your story is unique too, of where you came from and where you're at now. So who better to represent a homeless population or people struggling than someone that walked through their shoes. So Liz, please talk about everything that you've been doing.
Thank you, Dan. Let me first say thank you to County Executive Dan McCoy and Michelle McClave as the Commissioner for the Department of Social Services. No one agency can respond to this type of crisis. We have an existing partnership. It was certainly put to work over the last several months. I remember that first call that came in from a local hospital. They had a homeless person. That person had been tested, and now that person needed to be placed. So they contacted the Homeless and Travelers Aid Society. We immediately contacted the Department of Social Services, and I remember it was about 3 hours that both myself and Michelle and her team, we were on the phone trying to figure what would happen next. And as was spoken to earlier, that person went to a local motel, and that was the process for the bulk of people that were tested while we waited for the results to come back. Housing is healthcare. If you don't have some place to live, how do you social distance? How do you isolate? How do you wash your hands? Our shelters have done an outstanding job. We've been watching this all across the country, from Seattle, San Francisco, Los Angeles, Miami, Boston, New York. Without a functioning partnership, it's not going to work. People will die. The Homeless and Travelers Aid Society, in partnership with DSS, County Mental Health, the Interfaith Partnership for the Homeless, the Capital City Rescue Mission, Catholic Charities, St. Catherine Center for Children, the Albany Police Department, our Sheriff's Department, all of those entities and many, many more came together. I'd like to highlight one in particular. There's an outreach van, and you may have seen it. It's a white van. It's on the street every day between 2 p.m. and 10 p.m. They have been working one-on-one with the unsheltered homeless. We've seen a 47% increase in the unsheltered homeless count between this past July and last July. So understandably, there are a lot of unsheltered homeless people that don't feel comfortable seeking assistance through regular shelters. And that's understanding that the shelters, as Michelle spoke to, have done an amazing job keeping these places, all of them, absolutely as clean as possible. But people have options, and people get to make that choice. And some people simply feel that they would rather be on the street than in a shelter. That doesn't mean that they're not seeking meals, showers, and other services through those agencies. It just means they're sleeping on the street. So a 47% increase is dramatic. We're all working together to do whatever we can to ensure that they have access to health care and whatever services can be available. We knew this before going into this, but we know it now for certain. Housing is health care. We're rapidly working with the county, the city, and federal funders to make sure that we're bringing on as many housing units as we can as rapidly as possible. And that's what we call one of the programs. It's called rapid rehousing. And as we speak now, I know that the county is working on trying to bring on as many of those units as possible, as is the city. But there are some very real needs. Bathrooms. As businesses have closed down, as libraries, as nonprofits have closed down, the homeless need some place to go to the restroom. We're so thankful that the county stepped up and said, absolutely, let's provide those. We have recently taken on that responsibility, but we need for those restrooms to be reopened. They must be reopened. So we're going to be speaking with the city and others to do whatever we can. And it's not just the homeless, of course. Lots of people need to use the restroom, but that's an absolute basic need that must be met. Thank you.
Liz, thank you. And we have our common council member here, Chief, so maybe we can grab him after this meeting and talk to him about a few partnerships. So, but thank you for being here and what you're doing, and your inspiration to the younger community, but on Facebook too, what you're doing out there every day, leading by example. And that's why I say to everyone, you can, words are words, but everyone can utter words and tell you what you're gonna do, but actions speak louder than words, and your actions speak louder. So thank you, Chief, for everything that you're doing in the city. I also would be remiss if I didn't thank Sheriff Apple. He stepped up with the PPE for a lot of the homeless shelters and other businesses. We ran through his EOC. So thank you, Sheriff Apple. And then we did, for the first time, use his jail for the homeless shelter for, I think, a couple people, two or three people. It was something like that. I don't even remember. I can't. Yeah, 2 or 3 people we sent up there that were hard to place. So again, it's all done working together. I always say the journey at the top, when everyone says when you get to the top of the mountain's the happiest, I say it's the journey up the mountain, but it's the pebbles along that journey that trip you up. And as long as you don't let that keep you down and trip you, we can work together to make things happen. So again, this shows a great partnership between Hannes and our DSS and our county in general, just working with everyone. And I'll say to the viewers out there, we do need your help. We need your help to continue to do the right things, continue to clean your hands, continue to wear a mask, social distance, and hopefully we can get back on track to get back to some type of normalcy. I also want to remind people we do have the mental health hotline available 7 days a week, 8 a.m. to 5 p.m. The number, as always, is 518-269-6634. And then also our 24-hour sexual assault hotline number, 518-447-7716. And our 211 and our New York State hotline, 888-364-3065. One of the things someone brought up to us was the amount of numbers for like child being neglected or being assaulted and stuff like that. That number has gone down, and we were looking into it. Why did it drop? And one of the reasons is people don't realize that school teachers are mandatory reporters. So when it comes to a variety of other things, and I don't want to get into all the stuff that they do, but the teachers are on the front line, and they see these students that might be being, abused by their parents, being treated wrong, or some emotional issues. And now the fact that these kids aren't in school, that's another hit that we're taking. And not just, I say not the county, but these children are taking. It's another hurdle in life being thrown at them. And with many hurdles in front of you, it's hard to navigate. It's hard to navigate through life. And if you don't have someone looking after you or seeing this stuff, that's the other importance of schools being open. I know, listen, as a parent with a child in school, yeah, I'm nervous. I'm not gonna lie to you, I'm nervous. I don't, hesitant. What do? Try to send her back, do it via Zoom. But there's a lot of things that are getting missed in this equation during this COVID-19. And a lot of things are being overlooked because of what's going on, and everyone's focused here at this shiny ball when you got all these other elements of programs that we run in the county that are being lost in translation for a generation of kids, and kids and adults that rely on these services, or obviously rely on somebody that sees them every day and knows that they're in trouble. That's so important for certain schools to get back open for that reason there. So just for parents and for people to realize that, that's I want to put that out there. But again, thank you, and stay safe and healthy out there.